Leonard and June are up early every morning, and this is where they go.
When we retired, I played sports when I was in college. I'm used to working out every day, so I started doing it. And she said, "Oh, yeah, I'll go up with you." And I told her, I said, "You get addicted." Now we go every day. I'm talking about 7 days a week.
I do about an hour for myself, and he's on usually the treadmill. He can do the treadmill for about 30, 40 minutes.
Their morning routine had to stop when Leonard developed gallbladder pain.
I had really hard pain in my side. I went to the emergency room, and they said that my gallbladder was infected and the ducts were all plugged up.
They called in a surgeon, but it wasn't anything that he could do locally. So we ended up more or less them taking him. They put him in an ambulance and drove him to Hershey. And so that's where they took over with the gallbladder.
He developed cholecystitis, which is an infection in the gallbladder, typically related to stones within the gallbladder blocking up the tube that leads from the gallbladder downstream in the bile ducts. Most people, when they have cholecystitis, they get a surgery. We remove the gallbladder laparoscopically. It's a relatively straightforward and safe operation for most patients.
But Leonard could not have surgery because of a heart condition, so doctors treated the infection.
The type of procedure that he had initially is called a cholecystostomy tube. That's just a medical term for a tube that's put into the gallbladder.
The only thing they said was we put the tube in, and then you have a bag in the outside of your body, and the bile goes into the bag because it won't come through the ducts into your intestine system.
The problem was he's kind of now stuck in this situation of limbo where he still can't get a surgery. He still has stones in his gallbladder, and now he is on some level forced to live with this drain in place. And many patients like him are told that this drain is going to be a fixture for forever and that he'll need to have it changed every couple of months.
And I kind of figured I'm going to be stuck with this thing for the rest of my life, and it was not a lot of fun.
For 7 months, he was on the chair sleeping, and and you can't turn. You know how these chairs are. They're comfortable, but you can't move around. You can't go to your side.
If you're driving, going from here to Hershey, I'm in Center County. It's a 2-hour drive, and the seat belt sits right on that tube. Hurts like a 7 again. You can't eat. I lost like 40 pounds. I mean, you just don't get hungry.
Dr. Pauli and the team at Penn State Health developed a new cutting-edge procedure that could help Leonard.
He called me and said, "I think I know how to come up with a solution."
The name that we are using for it is called PEBBL, P-E-B-L. That stands for percutaneous, through the skin, endoscopic, small little camera, biliary, gallstone, lithectomy, which is a removal of a stone.
At this point, I was ready to try anything, as long as it wasn't going to be too dangerous. And I figure with Hershey being a research hospital, and they're, to me, one of the best in this area, and that's what they're there for.
I was just happy that somebody could do something, so he explained to me what he was going to do.
We simply used the drain track that he had in place to take a very, very small camera and remove all of the many, many, many stones that he had in there. The first time we did it, we took out more than 100 stones.
When he's taking the stones out, we're talking and everything because I'm wide awake. But when he took out a couple hundred the first day, and he showed me the bottle of all of them in it. And that's when I was like, wow, he just took all those out. That's gotta help.
He literally came down to the waiting room and even showed me a picture of them too on his iPhone, as well as drawing me a picture of what he did. Then he told Leonard, we have to probably go in there one more time. And a month later, we went down there and he took out the rest of them.
I think the second time we removed 5 or 6 small stones. We confirmed that there were none left behind because we don't want to leave any, because even one is enough to block things up. And once we were sure there were none left, we removed the drain.
Immediately, Leonard felt better.
I was just, wow, just amazed. Driving back in a car without the seatbelt hitting it.
So far, everything, he hasn't had any pain in that area. So we're just, hoping that this will be a solution for him.
Now I can sleep on my stomach again. Everything's just so much better. I got the rest of my life, so to speak, where I won't have all that pain, because it was bad.